Okay, I think we're recording. There's a blinking red light. Okay, take two. Magnesium. My name is Maddie Steele. This is for Nutrition 200. And here we go. Okay, what is magnesium? It is a major mineral in the body that is crucial to the function of both plants and animals. It's a major mineral because it needs more than 100 milligrams in your body per day. It's silvery white alkaline metal that is abundant in soil and ocean water. I didn't know it came from the ocean, and it plays a structural role in bone, cell membranes, and chromosomes. About 25 to 30 grams are found in the human body on average, and its chemical element is a chemical element whose atomic number is 12. And it's rich in both plant and animal products. About 60% is found in the skeleton, 27% is found in the muscle. 6 to 7% is found in cells, and 1% is found outside of the cell. Outside of cells. What does magnesium do? So it is actually required for active transport of ions across cell membranes. It regulates the blood. It reduces inflammation, decreases blood pressure, and possibly stroke by dilating the arteries and keeping the heart rhythm steady. It's necessary for over 300 biochemical reactions occurring constantly inside of our cells. It is required by the ATP synthesizing protein in mitochondria, and it prevents and is needed for DNA and RDA synthesis. It actually is they're looking into it preventing gallstones. Magnesium is found in, of course, food and supplements. So lots of food have magnesium. I chose, the average serving for that food. Like boiled spinach. That was crazy to think it has 157 milligrams per cup. So, if you had like creamed spinach, get a little fat, but also have a lot of magnesium. Have some oatmeal with almonds and chocolate. So your water, if you have hard water like we do here in Nevada, our water has a lot of minerals in it, but magnesium is actually one of them. And so you can actually get a lot of your magnesium from drinking tap water if you want it. Then it's, in a lot of over-the-counter multivitamins. I actually looked it up. It's not in One A Day Woman's, which I thought was shocking. It's, of course, there's Alive and Nature's Health and a bunch of others that did have magnesium in a variety of amounts. The RDA for magnesium is 400 milligrams per day for men and from 19 to 30, and it's 200 milligrams per day for women 19 to 30, and the magnesium increases about 10 to 20 milligrams per day beyond 30 years old. The deficiency symptoms are irregular heartbeat, weakness, muscle spasms, disorientation, nausea, vomiting, seizures, and the symptoms may be related to abnormal nerve cell function caused by an impairment of sodium and potassium pumping. The deficiency develops slowly since the body stores it regularly, so it won't really I'll hit you like a ton of bricks on, if you don't get your magnesium that day. The upper limit for magnesium is 350 milligrams per day, and it refers to the supplements or other non-food sources. Because if you get it from food, it's not all going to be absorbed. It's only about 30 to 40% is absorbed. So it's really if you take a bunch of supplements, then you'll really start to feel the effects of toxicity, which are diarrhea, kidney failure, since it's the primary regulator of blood, slowed breathing, eventual malaise, coma, and death. And it's older people are more at risk since kidney function declines with age. Some benefits of magnesium are the intravenous treatment could help with eclampsia, which is pregnancy diabetes, and severe asthma attacks. It's the main ingredient in many antacids and many laxatives, like you've probably seen milk of magnesia on the shelves and stuff. Safe option. It's a safe option for migraine prevention and treatment. It regulates blood sugar levels, and it could help with high blood pressure for people with prehypertension. So if you do have prehypertension, it'd be good to start taking magnesium supplements because, again, it's a very safe, natural way to calm your blood pressure and get back to, I guess, quote-unquote normal. It helps lower inflammation markers and could decrease symptoms of chronic depression. If you do want to go to that link, it's fascinating. They do have this study up there that that shows that it's a double-blind placebo study that shows that it could help with chronic depression symptoms. Its calming effect does promote better sleep, and I can attest to that because I actually do take it before bed sometimes. It is very, it calms the system. Sadly, not really quite a fun fact, but fewer than 25% of adults actually meet their RDA. Adults in the U.S. fall short of magnesium intake, with men and women averaging at about men at 349 per day and women at 267 per day. Only about 30 to 40% of milligrams, of magnesium is consumed. That's absorbed in food and things like that. So although we may eat a ton of food that's chock full of magnesium, we may not be taking it in, because the more, if you don't have a lack, your body doesn't absorb it very well. But if you do, if you don't have very much magnesium in your body, it actually jumps up to about 80% of absorption, which I thought was a very big jump. It's shocking. The word actually comes from, it's a Greek region, Magnesia, which is where the compounds of this element occur naturally. And magnesium is the 8th most abundant element and constitutes about 2% of the Earth's crust, which if you take 2% of the Earth, it's a lot of dirt. But of course, it's not just, you won't just see the silvery white magnesium. It'll just be part of the element. And there's why we're excited. So everybody, go have some chocolate oats with some almonds.